Hi, this is Brent Graham. It's a beautiful late spring day in Toronto, and I hope that summertime is dawning wherever you are as well. In the June 2023 issue of the Journal of Hand Surgery, there are two articles in the Editor's Choice section on the topic of distal radius fracture that I would like to draw your attention to. Our lead article was contributed by Mr. Andrew Lawson and his colleagues in Sydney, Australia. They're reporting some aspects of a randomized trial comparing volar locking plating to non-operative treatment comprising closed reduction and casting for distal radius fractures in individuals over 60 years of age. This particular aspect of their study looked at the longer-term patient-reported outcomes and correlated those with the radiographic findings 6 weeks after treatment. I think that this paper does add to the growing body of literature questioning the value of internal fixation of the distal radius in this particular age group. I also interviewed Mr. Lawson for this month's podcast, so hopefully you'll have an opportunity to listen to that as well. The second article in the Editor's Choice section I'd like to draw your attention to is a paper from Japan that used CT scanning to measure the prevalence of intra-articular penetration of screws into both the radiocarpal joint and into the distal radial joint when these screws were inserted during a volar locking plating. The results are somewhat surprising and a little bit sobering, so hopefully those of you who are using this method of internal fixation frequently will have an opportunity to read this. Finally, in our review section, we have three papers this month. In the hand surgery landscape is an article bringing us up to date on soft tissue management in partial hand amputations. And in Current Concepts is a somewhat related article on the use of ultrasound for mapping perforator flaps in the hand and upper extremity. And finally, in Current Concepts is a second article bringing us up to date on the important topic of elbow arthritis.